Our next speaker is Dr. Ali Soliman. Dr. Ali Soliman is a world-renowned economist and the former CEO and General Manager of the Islamic Cooperation for the Development of the Private Sectors. In addition to his academic careers that span several universities in the Middle East and USA, he has an extensive public service record, including service as the Senior Undersecretary Ministry of Economy and International Cooperation in Egypt and the Undersecretary of Ministry of Economy and International Trade. And he was also a Senior Economic Advisor for the Ministry of Planning in Saudi Arabia, among so many other positions he has performed. So, we are honored to have him today. Dr. Soliman, I'd like to give you the mic to reflect on how you see the world and the economy of the world after what's going on here. Thank you.
Hello, how is everybody? I'm very excited to be here with you today. I want to thank Dr. Ahmed Rashid and for the moderator, Dr. Tariq Rashid, and for the very illustrious groups that we are talking together today. Actually, Corona was a very big surprise for the whole global system, should we say. And I want to share the same ideas of my colleagues in saying this is a chance to pause, to think, to consider this pandemic as a chance to review the way we conduct our lives, the way we conduct our relations with other countries and with each other. Definitely, there are big hopes for maybe becoming more harmonious, more collaborative, more coordinating as a globe, as countries. Some features are encouraging. We see some countries extending some help to others. Perhaps the doctors from Cuba going to other countries, from Russia going to Italy, from Egypt we are sending supplies to other countries. So all of these things are very good. But in the same time, we are seeing aspects of competition, of struggle. Medical supplies which were destined for country A are being snatched by country B. Pharmaceutical companies making use of this crisis to charge higher prices or gouge higher prices. But in any case, it's a chance for us to reconsider really how are we dealing with each other as countries in a global system. We can talk, I will talk some more maybe about our point of view from developing countries. We discovered in Egypt, for example, belatedly, although it was clear to many of our specialized people, that we are not spending enough on health. We are not spending enough on health infrastructure. We don't have good infrastructure in immunization, in developing new drugs, research, and so on. We are very dependent on other countries for our supplies. I think this crisis will impel us to think more in terms of we cannot become a member in an international community without being stronger ourselves. We have to develop our own pharmaceutical industry more. Egypt is lucky in a way that we perhaps produce 90% of our needs, but we still have to strengthen our capability as a drug industry or pharmaceutical industry. We have also to strengthen our ability to develop immunization and other measures to protect us from this corona and other viruses. Another aspect that we need to consider is the social system we are living in. We have discovered that if you put people in isolation, if you prevent them from going out, you may protect them from a virus, but you are actually killing them by depriving them from their livelihood. Many people go out every day to make a living, and without a good social system, you cannot enforce in good, shall we say, in good conscience, you cannot impose isolation or social distancing if the man himself has to go out and work in a social system. So the luxury of living in Denmark is understood, but in India, Egypt, perhaps even Africa, you cannot really impose a system of isolation. A third thing that we really need to think about is the health insurance system. We see people in America and in Germany and other developed countries, they go to the hospital, they are being taken care of. They don't have to worry about paying for it. This is a luxury that is not available in many of our countries. So, in a nutshell, to consider this crisis is a way for us to pause, to consider, to think, to rethink our social system, to introduce better, they call it safety nets, better health insurance, a program to ensure that people will get enough to eat, as Dr. Kent was saying, as well as we have another issue for many of our countries where we have a lot of migrant workers. We have migrant workers in the Gulf countries and even in other European countries. And these people are not able to make money anymore. And the question is, how can we repatriate them, or how can we extend our social system or social protection to these people? So in a nutshell, I'm very grateful for this opportunity. I want to thank Dr. Ahmed for this. We have to rethink our civilization, and we have to think about modalities of collaborating together. Thank you.